Now, in the last 30 days, air quality levels have shown a clear daytime pattern in the national capital. The highest AQI was recorded between 7 a.m. and 8 a.m., averaging around 400, while the lowest AQI occurred between 2 p.m. and 4 p.m. with an average of 231. Delhi's air quality, in fact, in the entire month of December has remained alarmingly high, consistently falling in the severe or hazardous categories. Now, daily AQI levels have frequented between the range of 350 to 400 or higher, in fact, with severe instances of dangerous spikes even above 700. Now, at this point, experts attribute this severe pollution to temperature inversions, low wind speeds, increased local emissions, thus placing Delhi among the most polluted cities, not just in India, but in the world around this time. Now, viewers, looking at data from December 2025, mid-month readings repeatedly crossed into severe categories, with some locations even reporting AQI levels above 700. Let's give you some examples. On December 21st and 22nd, AQI levels hovered between 377 and 393, categorized as very poor and just very short of the severe category. While overnight readings dropped slightly but remained hazardous, ranging between 318 to 391. So overall, the air quality situation worsened significantly in this month compared to the previous years, prompting officials to now enforce GRAP Stage 4 measures in response to the escalating pollution levels. Now, shockingly, in 2025, not a single day out of 365 monitored days met the WHO safe air quality standards. Health experts warn that the risk to public health is extreme at this point, with increased chances of respiratory illnesses, heart disease, skin problems and mental stress, especially among the vulnerable section, including the children, the elderly and the individuals who already have pre-existing medical conditions. So clearly, the situation is very dire with regards to the health emergency that we're now witnessing in the capital. And to put these developments into perspective, I'm joined by Dr. Rajesh Chawla, Senior Consultant, Respiratory and Critical Care, Apollo Hospital. Thank you, Mr. Chawla, for joining us on News 9. I want to ask you, Delhi right now is in the middle of a health emergency. Almost every other person that we know either has a runny nose, is coughing or having difficulty breathing. So in the light of what we're seeing right now, how would you as a doctor assess this public health emergency?
You know, everyone in the city of Delhi is getting affected by this AQI.
Right.
Even sitting in a room, if you see the AQI, it will be more than 200. So even indoors, the AQI is very high. And it affects everyone, every organ. As you enumerated, it can affect a person, immediately if you go in this kind of weather with a fog, you will get nasal discharge, eye watering, and then you will get cough. And this PM 2.5, which gets absorbed, goes to the deeper part of the lung, get absorbed, it causes a lot of inflammation, like heart attack, it can cause stroke, it can cause lung cancer. But I think everybody in Delhi is a smoker. So all the side effects which you see in a smoker will be seen in everyone. People are having cough, there are early COPD, chronic obstructive lung disease. The viral infections take longer to heal. Many of the patients can get lung cancer and even stroke. So that it is really alarming. And every year in these 2 months we talk, but year after year it is deteriorating. It is not getting better. There is no effort on the government or anywhere to just tackle this. Because if you're staying, your work is in Delhi, you have a house in Delhi, you can't go anywhere else. And it is the responsibility of the government to take stern action. And I think unless the Prime Minister steps in, nothing is going to happen, because very strict action will have to be taken to really decrease this pollution at every level, industry, vehicles, and the other things.
Right. Dr. Chawla, you just mentioned that we're looking at increased cases of respiratory, cardiovascular, and even pulmonary diseases. So if you could just go ahead and explain to our viewers, How does the continuous exposure to AQI above 300, that is what we're witnessing for the past few days, how does it impact our health immediately and also in the large run? Like, are the risks now irreversible? Are we looking at a generational damage?
You know, the children, when we were young, we were exposed to good AQI. Now the young person who is born today, he is exposed to this kind of AQI.
Right.
So immediately, if he gets a viral, it will take longer time to heal. He's getting the chances of getting infections or the respiratory problems are more. And as this child grows, his growth is going to be affected by this kind of AQI. And even they have seen there is a degenerative disorders which are being seen in children, like their IQ and other things will also get affected over the years. As far as the adults is concerned, immediately as you asked, person will have cough, which I enumerated. You will have a irritating cough when you come home. You have irritating cough. You do some gargles and black soot comes out. So
Right.
this is the immediate, and when over the years it gets exposed and there are glands in our airways which get inflamed, which produce more mucus, and after exposure to few years, many of these patients will develop a chronic obstructive lung disease like you develop in smoking. In addition to smoking, air pollution is also a risk factor for chronic obstructive lung disease. So this is the commonest, and people who are suffering from respiratory illness, these tumors are very bad. They get admission, they get infections, their symptoms are worse, they get exacerbations. The oxygen requirement goes high. So these can happen. And then over the years, many of these patients who are exposed to this kind of irritant, they have carcinogenic or causing cancer. They have reported breast cancer, lung cancers, and other cancers in relation to air pollution. So I don't know, why we are spending so much in treating these patients when we can do something to prevent that. Everybody has a right to have a fresh air. As a citizen, I have a right to have a fresh air.
Right.
And it is
Right to health is our fundamental right. Sir, on that
yes.
point, I want to ask you, because you mentioned that we're looking at major consequences in terms of, life-threatening experiences and diseases as well. Are we also cutting down on our years when we are exposed to this poisonous air? Are we looking at reduced lifespan as well?
It is said that the people who are exposed over the years, 5 to 10 year lifespan is reduced if you are staying in the city of Delhi. So definitely people who are staying in the city of Delhi and NCR, their lifespan is going to be less like in a person who is staying in Uttarakhand or place where there is a clean air. The surgeons say that when they operate any lung of a Delhi person, it is black. Only even in
Even if
rural
it's a
areas,
non-smoker.
yes, like a smoker, and they are very bad. In spite of the fact many of these patients are not smokers,
Right.
and when they operate on a patient who is a foreigner in Russia, it's a pink. So that is the kind of pollution we all are taking in our body, and we think it doesn't affect us. Everybody is getting affected. You breathe 60, almost 12 times a minute, 720 times in an hour. So you are inhaling so much of this dirt inside in 24 hours, and years after years, days after day, and it will have an impact on almost everybody.